All right, today we're tackling a topic that is front and center for anyone taking care of a child: respiratory illnesses. Honestly, just being able to understand what's going on when a little one gets sick, that's one of the most powerful tools you can possibly have in your toolkit. You know the feeling, right? It's the middle of the night, you hear a little cough from the other room, you feel a warm forehead, and your mind just starts racing. Is this just a simple cold, or are we looking at something more serious? Let's dive in and try to get some real clarity on that.
So, where do we start? Let's kick things off with two of the most common hurdles in all of childhood: RSV and the ear infections that love to tag along. First on our list is RSV, or Respiratory Syncytial Virus. You've probably heard of it, and for good reason. It's so common that pretty much every single kid has had it by the time they turn 2. For most, yeah, it's just a nasty cold. But the real reason we take it so seriously is its potential to cause bronchiolitis, which is just a way of saying inflammation of the teeny tiny airways deep in the lungs.
So why are infants so much more vulnerable to RSV? Well, it's really a perfect storm of biology. I mean, think about it. Their airways are incredibly small, like tiny little straws. Their cough just isn't strong enough to clear out all the gunk, and boy, do they produce a ton of mucus. Add in an immune system that's still learning the ropes, and you can see how even a little bit of swelling can cause a great big problem. And you know what often goes hand in hand with a respiratory virus? Yup, the dreaded ear infection. It's a classic 1-2 punch. A virus like RSV causes all this swelling and mucus, which then creates a traffic jam and blocks the eustachian tube. That's the little canal that connects the throat to the middle ear. All that trapped fluid just sits there, creating the perfect warm, swampy environment for bacteria to grow.
Okay, check this out. This slide explains so much about why kids get so many ear infections. Just look at the difference. In a child, that eustachian tube is shorter, it's straighter, and it's way more horizontal than in an adult. It's basically a direct downhill superhighway for germs to travel right from their throat into their middle ear. Now, let's talk about coughs. Because sometimes the biggest clue isn't that a child is coughing, but how they're coughing. The sound itself can tell you a whole story. So let's play detective and decode the difference between two very distinct illnesses: croup and pertussis. This chart just lays it all out perfectly. On one side, you've got croup. Its telltale sign is that shocking barking cough. I mean, it literally sounds like a seal. That's caused by a virus making the upper airway swell. On the other side is pertussis, which you probably know as whooping cough. This is a whole different beast. It's bacterial, and it causes these awful, violent coughing fits where they just can't stop. And that high-pitched whoop, that's them desperately trying to gasp for air when the fit is over. For infants, it is incredibly dangerous and can actually cause them to stop breathing. And here's the really tricky thing about pertussis: it's a master of disguise. For the first week or two, it just looks like a regular old cold. But that's the sneakiest part, because that's when it's the most contagious. It's only after that the really bad coughing fits kick in, and those can last for weeks before things slowly, finally start to get better. Okay, we need to shift gears now and talk about something really serious. Because sometimes these symptoms go from concerning to this is a true medical emergency. And knowing these red flags is absolutely critical.
The condition we're about to cover requires immediate, urgent medical help. This is not a wait-and-see situation. This is a 911 situation, period.
So what is this emergency? It's called acute epiglottitis. It's a bacterial infection that causes the epiglottis, that's the little flap of cartilage that covers your windpipe, to swell up incredibly fast. When it swells, it can act like a cork and completely shut off the airway. We are talking about a matter of minutes.
And here's where it gets really counterintuitive, because the signs aren't what you typically expect. The 3 classic signs are actually about what's not happening. There's no cough because the airway is too swollen. There's drooling because they can't even swallow their own saliva. And there's extreme agitation. That's not a tantrum. That is pure panic from not being able to get enough air. They are literally fighting to breathe.
And this is maybe the single most important thing to remember. Listen closely. You never try to look in the throat. Don't use a finger, a spoon, a tongue depressor, nothing. The slightest stimulation could trigger a spasm that slams the airway shut completely. This is a hands-off emergency. You call for help and you wait for a specialized medical team to arrive.
So, beyond that one specific condition, let's arm you with a universal checklist of red flags. Think of this as your go-to-the-ER now list for any respiratory illness. If you see any pauses in breathing,
a bluish color around their lips or on their skin, their chest sinking in with every breath, or if they're just limp and unresponsive, those are all signals. Don't wait, don't second guess. Get help immediately. All right. We've been talking a lot about infections, things you catch and then hopefully get over. Now we're going to switch gears entirely to a chronic, lifelong genetic condition that has a huge impact on the respiratory system, cystic fibrosis. This is a totally different perspective, not about fighting off a bug, but about managing a condition day in and day out. So cystic fibrosis, or CF, is what's called an autosomal recessive disorder. This chart breaks down what that actually means. If both parents are carriers of the faulty CF gene, and they probably wouldn't even know it, then with every single pregnancy, it's like a roll of the dice. There's a 25%, or 1 in 4, chance the child will have CF, a 50% chance they'll be a carrier, and a 25% chance they'll be completely unaffected. Okay, so what is this gene actually doing in the body? Well, it basically breaks the system that manages how salt and water move in and out of cells. The result? The body's mucus, which is supposed to be thin and slippery, becomes incredibly thick and sticky. Seriously, think of the difference between water and honey. And that thick, sticky mucus starts to clog up tubes and ducts all over the body. And that clog is not just a lung problem. It causes issues everywhere. In the lungs, yes, it traps bacteria, leading to chronic infections. But it also blocks the pancreas, which means digestive enzymes can't get out, leading to poor weight gain and malnutrition. It's why a classic sign is very salty skin, and why one of the first signs in a newborn can be a blocked intestine. It just shows how one tiny genetic issue can have these huge, body-wide ripple effects. I know we've covered some really serious, even scary stuff, but here is the good news. Knowledge is power, and now we get to talk about the most powerful tool of all, prevention. And when it comes to RSV, we are living in a revolutionary time. There are some incredible new breakthroughs. First, a vaccine can be given during pregnancy that passes protective antibodies directly to the baby, giving them protection right from birth. Then, for infants themselves, there's an antibody shot that acts like a shield, protecting them through that entire first, most vulnerable RSV season. It's a total game changer.
For whooping cough, our best defense is still vaccination. The DTaP vaccine series protects little kids. But here is the crucial part. That immunity can fade over time. That is why it is so incredibly important for all the adults around a new baby, parents, grandparents, caregivers, to get a Tdap booster. You're creating a cocoon of immunity, a protective bubble around that infant before they're old enough to be fully protected on their own.
You know, when you really think about it, from the specific sound of a cough to the silent but urgent signs of an emergency, knowing the difference truly can make all the difference. It's what empowers us to give the right comfort, to seek help when we need it, and to use the tools of modern medicine to protect our most vulnerable. So the question to leave you with is this: is your family protected?